We don't have a ton of time left, but I'd love like a quick recap on your thoughts for patients who like radiation levels. My understanding is typically under 60 grays. You're in a much better place for implant placement. So I'm curious on your thoughts on that and where you're comfortable placing implants.
55 to 60 grays, that should be the cutoff. But the more important thing is that you get with the oncologist and you look at the mapping. Where was the radiation given? What was shielded and what was not shielded? And they are very good at shielding. So if that radiation treatment is probably in the last 8 years, 10 years, they probably had excellent shielding techniques. Even if it was head and neck radiation, they probably had excellent shielding techniques. And if that bone was shielded, then you probably don't have much of an issue whatsoever. But you've got to talk with that oncologist. They are very willing to talk with you. They knew the consequences of oral surgery in somebody with radiation, and they didn't want those patients to have a problem. And so I found if there's one group of physicians that'll give you everything, they'll lay it all out there, it is the oncologist. So one, make sure you do a consult, make sure you get the number of grays, make sure you get the mapping. And again, make sure there's no inflammation in the mouth, because we believe, we don't have the literature to support it, but we believe we would probably have something similar with that lack of inflammation allowing us to have better healing force there. Then depending on what it is, then we may have to be talking about hyperbaric oxygen and things of that nature.